Good day, students. My name is Mr. Vernon Fredericks, and I'm going to do the vocabulary book 4, Unit 7, Presentation 2. And this has to do with medical stuff, yeah? Okay, so let's continue with our presentation. Yeah, welcome. And please have a notebook and a pen with you just to take notes and maybe just to clear up some things for you, yourself. Okay, so let's continue. Okay, um, here we have two pictures. And with the pictures, there are different types of questions. Yeah, let's first look at let's have a look at the first picture. They are the doctor and the patient. Yes, and the doctor is showing the patient something, um, maybe a diagnosis of what's happening. And picture number 2, we just have a doctor there with his hands just standing there, and is just putting his hands to the side. Yeah. Okay. So picture 1. Does the man care about the doctor's advice? The answer is yes. Yes, he does. He is paying attention. Is the doctor giving him a suggestion? Yes, he is. Explaining the plan that the patient should follow. Yeah. So in picture number 1, the doctor is giving advice and he's giving ideas of what the patient should do. Okay. Let's read picture number 2. Is the doctor giving advice? No, he isn't. He doesn't seem to know what to suggest. Yeah. Does he have a suggestion? No, he doesn't. He has no clear point of what he wants to tell the people. Okay. Okay. So here again, we have two pictures. Okay. Okay, let's read. Will antibiotic cream cause infection? No, it won't. Okay. Next question. Is it a medicine that helps cuts from getting infected? Yes, it is. Antibiotic cream prevents infection. Will it help him? Yes, it will. Will it make a cut worse? No, it won't. It will make the cut to heal. Yeah. So we use antibiotic cream to make sure that the cut doesn't get infected. Okay. And it will help the patient to get better. Next slide. Okay. Picture 1. Question 1. Did he put a bandage? Yes, he did. Is the cut protected? Yes, it is. Okay. So students, if you remember, the bandage is the thing that covers the place where the person got hurt. Okay. So it's a covering to make sure that the cut doesn't get infected. Yeah. And spread wider. Yeah. It is to close the cut. Picture number 2. Did he put a bandage? No, he didn't. Is his cut protected? No, it isn't. So in picture number 2, the cut can get more infected and it can become a problem for the person. Yeah, it will also take longer to get better because the cut is open and other germs might get in there as well. So picture number 2 is not a good thing because the cut has no bandage. Okay, he didn't put any bandage on and the cut is open so that other things can get in there and make the cut infected. Next slide. Okay, picture 1 and picture 2. Okay. Okay, let's read picture 1. Is the leech sucking blood or water? It is sucking blood. Yes. Question number 2. Is blood a liquid or is it a solid? It is a liquid. Okay. So in picture number 1, the leech is taking the blood out of the person's body. Okay, picture number 2. Okay, is this person donating blood or water? He is donating blood. Is blood red or colorless? It is red. And if you see in picture number 2, students, this person is giving off his blood so that should there be a shortage of blood in the hospitals, yeah, they can use this person's blood for patients that need blood. Maybe they've been in an accident, or maybe they have a shortage of blood and they need the blood to continue with their life. Okay, let's move on. Okay, picture 2, picture 1. Okay, students, what do you think is happening in picture 1? Okay, these two gentlemen are speaking. They are looking at maybe at their tab, yes, and they are speaking about something, maybe business. In picture 2, it's almost like these two men are fighting. Yeah, they don't have a good relationship. They don't talk in a nice manner. They are speaking as if they want to fight with each other. Okay, let's have a look at picture number 1. What does it say there? Are they talking calmly? Yes, they are. Are they gentle to each other? Yes, they are. Yeah, they're speaking in a nice manner. Picture 1. They don't speak over each other. They listen to each other and they pay attention to what each other is saying. In picture number 2, are they talking calmly? No, they aren't. Are they gentle to each other? No, they aren't. They are shouting at each other. They are speaking to each other. It almost looks like that they're going to fight. Yeah, they don't have a nice way of speaking to each other. So calmly means speaking in a nice manner, speaking in a calm manner, speaking in a gentle manner. Yeah, speaking in a way that people can understand you and people can hear you. Okay, picture number 2 is not a good example of how to speak to each other. Okay, students, now we have a picture here. What I eat in a day. What I eat in a day for breakfast, 342 calories. Okay, mid-morning snack, 218 calories. Lunch, 323 calories. Dinner, 328 calories. And a bonus is 100 calories. Okay, so what are calories? Calories are what we take in our food, the energy that we have in our food. Okay, let's have a look at the questions. Does everything you eat have the same number of calories? No, it doesn't. Different types of food have different calories. So for example, students, if you look at the breakfast, it has 342 calories, yeah? Pancakes and 1 apple, 342 calories. Okay, for mid-morning snack, for a snack, a snack is between breakfast and lunch, or breakfast between lunch and dinner, yeah? But that's a snack, okay? Different types of food have different calories. Okay, next question. Do we use calories or kilograms to measure the amount of energy food produces? We use calories, okay? And if we don't use the calories that we get from the food, we become fat because we don't burn those calories, yeah? So the calories, all the energy that the calories produce, because we don't use the energy, our bodies just become fatter because we're not using those calories. So students, it's good if you exercise, if you go to the gym, yeah, because I know you eat a lot of kapsa and it has a lot of calories, and it's good if you burn the calories so that you can use that energy of the food to exercise. Okay, next slide. Chronic complications of diabetes. Okay, so if you look at the picture there on your left, This is what can happen if you have diabetes. Okay, so can you remember what is chronic again? Does anybody know what is chronic again? Do you still remember? Chronic means something, a disease or a sickness that you have for a very long time. On the picture on your left hand side, you can see if you have diabetes, what can happen to your body. Okay, so let's go on the left. If you have diabetes, you can go blind. You cannot see anymore. Okay, so your eyes become infected. Okay, the next one is you have kidney disease. Your kidneys don't work anymore. Yeah, because of the sugar. Then you have nerve damage. Nerve damage means your nerves, you cannot feel properly anymore in your hands. Yeah, your nerves don't work anymore, so you cannot feel properly. Yeah, the last one here on your left hand side is amputation. This one, amputation. Amputation means if you hurt your foot, yeah, if there's a cut in your foot and you are diabetic, the cut will take a long time to get better. And because it takes a long time to get better, the foot will not heal properly. And then the doctors have to cut the foot. Yeah? Okay. On your right hand side, it says the cardiovascular disease, which means you have a stroke, which means parts of your body doesn't work properly. You have a heart attack, and you have loss of circulation in arms and legs. Yeah, the blood doesn't flow in your body. Okay, so these are the complications of having diabetes. Yeah, okay, let's go to the questions on the right. Is diabetes a chronic disease? Yes, it is. Does it continue for a long time? Yes, it does. Does it last for a short time? No, it doesn't. So, what does chronic mean? Chronic means a disease or a sickness that you will have for the rest of your life. Chronic means a disease or a sickness that you will have for the rest of your life. If you have it, it cannot go away. There's no cure for it. So, diabetes, hypertension, asthma, yeah, high blood pressure, hypertension. Okay, so these are the things, the diseases that is chronic. So be careful, students. Eat properly and exercise. Okay, two pictures again. Two pictures again. Okay, so in one picture, you have a doctor speaking to a patient, an older man. Yeah, and they're speaking calmly and they're speaking in a nice manner. In picture two, you have one gentleman standing with a stick in his hand and he wants to hurt the man, the, the, the person who works for him who's sitting at the desk. Okay? Okay. So let's read the questions. Is the doctor convincing the patient? Yes, he is. So what does convincing mean again? What does convincing mean? You still remember? Okay, convincing means trying to get somebody to believe what you are saying. Yeah? Question number two, does the doctor want the patient to believe him? Yes, he does. Okay? Yes, he does. Okay, picture number two. Question one, picture number two. Is the boss convincing the employee? No, he isn't. Yeah, he's actually forcing the employee. Question number two, is the employee going to believe his boss? No, he isn't. The boss is using force. Yeah, the boss is trying to force him to believe him. Okay, so in picture number one, the doctor is speaking in a nice way and is convincing the patient. In picture number two, the boss is not speaking in a nice way and he is not going to convince the person who works for him. Okay, next slide. Okay, so now we're going to talk about asthma. Yeah, Okay, you can see there's an inhaler. Picture number 2, the person is using the inhaler. Okay, so that is helping to control the asthma. Yeah, it's not a cure for asthma. Okay, let's have a look. Remember, asthma is also a chronic disease. Yeah, let's have a look at question number 1. Is there a cure for asthma? No, there isn't. Is there anything that can make it go away? No, there isn't. There is no cure. Yeah, cannot help. Yeah, okay. So let's read here at the bottom. Is there a cure for asthma? Asthma cannot be cured, but it can be controlled. Most young people with asthma should be able to live healthy, active lives with minimal symptoms. So even if you have asthma, you can still play basketball, you can still play football, you can still run, you can still go to school, you can still play table tennis, you can still swim, you can still do things like normal people do, okay, without any asthma. So asthma shouldn't stop you from doing things. Okay, next question. Okay, is an inhaler a cure for asthma? No, it isn't. Does an inhaler control asthma? Yes, it does. So when people are feeling that they're getting an asthma attack, they can use the inhaler to control the asthma. Yes, but there is no cure for asthma. Okay, next slide. Okay, here you see an older man lying in bed, and there's a young man with him. Okay, and the young man is giving him tablets and some water to drink. Okay, what is the question here? Is he taking tablets to cure or to cause an illness? He's taking the tablets to cure an illness, yeah, to stop the illness. Will the illness make him feel sick or better? Or, sorry, will the tablets make him feel sick or better? It will make him feel better, the tablets, yeah? So the sick person is going to drink the tablets to make him feel better. Okay. Okay, next slide. Let's have a look at the picture there. Okay, what is the old man doing? Okay, there's a doctor with him. Okay. Okay, so he's sitting on a ball. Okay, and behind is a young lady or a little older lady walking on crutches. She's learning to walk again. Okay, so maybe these people are doing physiotherapy, yeah? Okay, physiotherapy. Let's have a look at the questions. Is the doctor helping the man deal with his injury? Yes, he is. Okay, so the man is helping to deal with, yeah? To just fix the problem and to deal with the problem and to look at the problem and to try to fix it. Question number 2, does lifting some light weights help solve the problem? Yes, it does, because it makes this muscle stronger again. Does the man have a choice? No, he doesn't. He needs to do the exercise to get better. Okay, so usually when older people had an injury, they have to do the exercise to get better. Okay. Okay, let's have a look at the picture there. The doctor is drawing blood from somebody. Yeah. His temperature is at 102. Okay. Okay. The word that we're going to use here is diagnose. Students, do you still remember what is diagnose? You still remember what the word diagnose means? Diagnose means to find out what the real problem is and what we can do to fix the problem. Okay, so let's have a look at on the right-hand side of the words. The doctor is doing a test to diagnose diabetes. Doctors doing a test to find out if the person has diabetes. Yeah. Question number 1. Does the doctor already know if the person has diabetes? No, he doesn't. Does the doctor want to find out if the patient has diabetes? Yes, he does. Can the doctor determine whether or not the patient has diabetes without this test? No, he can't. It helps him to identify the illness. Okay, so the doctor is using the test to find out what the problem is. Diagnosis means the doctor is doing the test to find out what the problem is and what are the solutions to the problem. Okay. The next word is encouraging. Encouraging. Okay. So if you look at picture number 1, is that encouraging? You can still remember what encouraging means? Okay. Is picture number 2 encouraging? Is picture number 2 encouraging? Okay. So what does encouraging mean again? Encouraging means that you are speaking and helping the person to achieve their goals. Okay. Usually there is somebody else to encourage another person. Usually there are 2 or 3 people encouraging another person. Okay. Question 1, is he encouraging him to do more reps? Yes, he is. Does this give the man who is lifting weights some confidence? Yes, it does, because there's somebody to push him. Yeah? In picture 2, is anybody encouraging him? No, there isn't. It's him alone. Yeah? Does he have support from anyone? No, he doesn't. He doesn't have somebody to help him or to encourage him. Yeah? So picture 2 is all alone and there is no encouragement. Next slide. Hey, let's have a look at picture number 1, or this picture here. And the word we're looking at is a fever. Okay, question number 1, does he have a fever? Yes, he does. How do we know he has a fever? If we look at the picture, how do we know he has a fever? You can see he has a piece of cloth on top of his head, yeah? Usually people have a fever, they put some hot cloth or a cold cloth on their forehead to bring the fever down. Okay, is his body hotter than normal? Yes, it is. Is he feeling well? No, he isn't. How does he feel? He is sick. So students, what does a fever mean? A fever means your body temperature is higher than it should be, or it is lower than it should be. Sometimes people get a hot fever. Sometimes people also have a cold fever. In this case, we are looking at a hot fever. Okay, the word is firmly. The word is firmly, yeah? The adverb is firmly. Okay, so what does firmly means? Firmly means holding tight. Just holding it tight, yeah? Is he holding the rope firmly? Yes, he is. Is he holding it in a strong way? Yes, he is. Is it easy to pull it out of his hands? No, it isn't, because he is holding it in a strong way. And it's very difficult to get the rope out of his hands. Yeah? So firmly means holding on to something very tight and holding onto it very strong. Okay, flowing is the word, the vocab word that we're going to use. Okay, flow, flow. Okay, so what does water that flows means? What does it mean? It means the water is moving. Okay, it's moving from one point to the other point. Picture number 1. Is this water flowing? Yes, it is. It is moving, or is it moving? Yes, it is. Okay, picture number 2. Does this water flow? No, it doesn't. Does it move from one place to another? No, it doesn't. In picture number 2, the water is standing. It's just standing there. Yeah. It's not flowing, it's not moving. In picture number one, the water is flowing. Yeah, it's coming from the top of the mountains and it's going down and it's going into a little river and it comes down the mountain again. Yeah, so the water is moving, it is flowing. Yeah. Picture number two, the water is standing still, the water is quiet. There's no movement in the water. Okay. Okay, next slide. Okay. The word we're going to do is gently. Okay, students, you remember what gently means? You remember what gently means? Okay. So gently means the same as softly, yeah? Doing something very softly and very kind in a gentle manner, in a very quiet way. Yes? Okay. Question number one. Did he put the glass gently on the table? Yes, he did. Okay. Did he put it hard on the table? No, he didn't. He put it down gently and softly. Okay, if you look at picture number two, did he put it down hard on the table? Yes, he did. Did he put it down gently on the table? No, he didn't. Yeah? He didn't do it very gently. He didn't do it very softly. How do we know that? Because in picture number two, we can see that the glass broke. So he must have put it down very hard. Because if he put it down very hard, the glass broke. In picture number one, there's still some water in the glass. So he didn't break the glass. Yeah. In picture number one, he put the glass down gently. Okay. Okay. Next word. The next word is habits. Think quickly, students. What does habits mean? What does habit means? What does it mean? Okay, quickly. Okay, so there we have a picture. There we have a picture. We have good habits. Doing exercise, drinking juice, eating fruit, playing football, eating vegetables, drinking milk, eating cheese, eating fruit. Okay, these are all good habits. Then we have bad habits: smoking, playing PlayStation, drinking beer, McDonald's, French fries, burgers, ketchup, ice cream, cake, sugar, a lot of fatty chicken are all bad habits. Okay, so what are habits? Habits are things we do regularly. Habits are things we do regularly. Yeah? Let's have a look at question number one. Are habits things you do regularly? Yes, they are. Are all habits good? No, they aren't. Okay? As you can see from the picture, are all habits good? No, they aren't. Are all habits bad? No, they aren't. Yeah? So habits are things that we do regularly. Yeah? Okay. What we eat regularly, what we do regularly. Do we exercise? Yeah? Don't we exercise? These are all the things, yeah, that make for good habits and for bad habits. Okay, students, just take 1 minute and read through this, please. Okay, protect yourself from diabetes. Okay, protect yourself from diabetes. Just read for me the picture quickly. Okay, 20 seconds, 30 seconds quickly. I'll be with you now. Okay, the word is keeping track. Okay, protect yourself from diabetes. Follow this step to keep track of your health, to keep follow these steps to keep your health on track. Okay, take your medicine, your medication, yeah? Have a healthy weight. Do exercise. Check your heartbeat. Don't smoke. Okay? So if you have diabetes, you have to do these things, yeah? Take your medication. Be a good weight. Do exercise. Yeah? Control your blood pressure, control your blood pressure and eat healthy, and don't smoke. So what does keep on track mean? Keeping on track means you check if everything is okay. Yeah, you have to check if everything is okay, that you are on the right road to be and live a healthy life. Okay, so question number one, keeping track of diabetes is important. Does this mean paying attention to diabetes? Yes, it does. So you have to know what is good for you and what is not good for you. Does this help maintain good health? Yes, it does. Okay. Is this optional if you want to live a healthy life? No, it is not optional. You have to do it. Yeah. So keeping track means you have to look at yourself and always be aware of what you eat, what you do, your medication, no smoking. Okay. And don't get overweight. Yeah. Stay at a good weight. Okay, so keeping track means that you pay attention to what you do and what you don't do. Next slide. Okay, medication is the word. You still remember what is medication, students? Okay, you still remember what is medication? Yeah, medication is what we take to get better. Yeah, is the doctor giving the patient some medication? Yes, he does. Will the patient feel better? Yes, he will. Will the sickness get worse? No, it won't. So we usually take medication if we are sick. If we have the flu, we take medication. If we have a headache, yeah, if our head is paining, we take medication. If our body is not feeling right, we take medication. Yeah. And sometimes people that have, or most of the times, people that have bigger health problems have to take a lot of medication. Yeah, so medication is important for the patient to feel better. Okay, next slide. Okay, mental. What is mental again? What is mental again? Mental, question number one, does mental relate to the mind? Yes, it does. Does it also relate to the heart? No, it doesn't. Is mental health important? Yes, it is. Okay, so let's have a look at the picture there. So these are all the things that are related in our brains, yeah? In our brains, in our minds, yeah? The first one is grief. It's not written properly there, but it's grief. Feeling sad, anxiety, feeling nervous, phobias, afraid of some things, post-traumatic stress, yeah, feeling stress about something that happened, yeah, and then there's stress as well. Then there's feeling of shame, yeah, not feeling well, yeah, not feeling good about yourself, shame. Then there's depression, yeah, feeling a big load of sadness and also panic. Yeah, so these are all things related to the mind, what is happening in our minds. Yeah, and mental health is very important, students. It's very important for all of us. Yeah, we have to stay healthy in our minds. Okay, the next word is monitoring. What does monitoring mean? What is monitoring? Monitoring means to check and to keep record of some things. Yeah, to check and to keep record of some things. Okay, so here we have the picture. So the person is taking their blood sugar level, yeah? In picture number one, they're taking their blood sugar level, yeah? And in picture number two, they are writing it down. So maybe every day after breakfast, every day after lunch, every day after dinner. They write down what their blood pressure is or blood sugar level is. Okay, to make sure that the diabetes are not high or very low. Okay, so monitoring means to check if everything is okay and to keep a record of things. So let's have a look at the questions. Is monitoring blood sugar levels important? Yes, it is. It's very important. Question number 2. Does it help? Does it help to see how blood sugar levels change over time? Yes, it does. Okay, so you can see if it's good or if it's bad. Yes. Third question, is monitoring about checking or ignoring something? It is about checking. So monitoring. So for example, students, if you are doing good every week in the exam, okay, I see your grades, I see you are doing well. 1 week your grades go down. Yeah. I speak to you because I'm monitoring your exam results. Your teachers are monitoring it. Yeah. They are checking how did you do for this exam. If you did bad, the teacher will speak to you. What is the problem? Yeah. And then hopefully next week, your grades or your exam results will go up again. Okay, next slide. Okay, the word is motivating. Yeah, motivating. What does motivating mean? You still remember what motivating means, students? Motivating means the same as encouraging. Yeah, encouraging is to help, to speak to the person and to encourage them to do better. Okay, what do you think the doctor is saying to the patient? She's probably telling her to take care of herself by following the doctor's orders so she can get better. Is she motivating or demotivating the patient? She is motivating the patient. She's encouraging her to do better and to listen to the doctor. Yeah, so motivating means to do better. Yeah, helping a person, speaking them to do better. Okay, next slide. The word is patiently. Patiently. Okay. Too many in the picture are waiting for their friend to finish shopping. Are they upset or not? Are they upset or not for waiting for a long time? Are they upset or are they not upset for waiting for a long time? Okay, they are upset. They are tired from waiting for a long time. Okay, and students, you can see this in the mall. Sometimes this is the men sitting outside in the mall in the shops, waiting for their wives to finish shopping. Yeah, and this is how their faces sometimes look. Okay, these men are upset. They are tired from waiting for a long time. Okay. Do you think, question, do you think they are waiting patiently or impatiently? Okay, they are waiting impatiently. Yeah. So what does patiently means? Patiently means is to wait. Patiently means to wait without getting angry. Yeah. These men are angry. They are upset. Yeah. But to be patient, to wait patiently, is to wait without getting angry. Okay. So we see this a lot in the malls. We see this a lot in the shops. The men waiting outside and the women inside shopping. And the men are upset because they are waiting for a long time for their wives to come out. Okay, a patient. The word is patient. Okay, we have A and B. So, who is the patient between persons A and B? The patient is person A. Who helps the patient? Person B helps the patient. He is a medical doctor. So, the doctor helps the patient. Okay? So, students, okay, the patient is the one who is sick. The doctor is helping the patient. Okay, the patient is sick, the doctor is helping the patient. Okay, the word is pattern. Okay, how do we brush our teeth in the mornings or in the evenings? Okay, number one, toothpaste on toothbrush, tap on, water on toothbrush, brush teeth, spit, rinse toothbrush, drink of water, and floss between your teeth. Yeah. Do you think everyone should follow this way of brushing teeth every day? Yes, it is the regular way of brushing teeth. You think this toothbrushing pattern is easy to or difficult? It is easy and simple to follow. So the pattern is, what do we do? What should we do every day for brushing teeth? Okay, this is the pattern. What is the Arabic word? I'm not sure what the Arabic word is, yeah? But this is the pattern. Number one, toothpaste on toothbrush. Number two, tap on. Number three, water on toothbrush. Number four, brush teeth. Number five, spit. Number six, rinse toothbrush. Number seven, drink water. And number eight, floss between your teeth. Okay, this is a pattern. Okay, the word is physically. Physically, yeah? Okay, physically. Let's have a look at the picture. What are these students doing? What are they doing? They're exercising. They are training their bodies. Yeah? They're doing some exercises. Question number one. Which class do you think these students are in? They are in a physical education class. What are they training? They are training their bodies. Yeah? Do you think they will be strong physically or emotionally? They will be strong physically. Their bodies will be strong because they're exercising it. Yeah? Okay, next slide. Okay. The word is popular, famous. Is he popular? Picture number one. Yes, he is. How do you know? He is a world famous soccer player who is liked by many people. So he is famous. He is popular. Picture number B. Is he popular? No, he isn't. How do you know? He's not well known. Everybody doesn't know his name. Okay, so picture B is not popular. Picture A is popular. Okay. Question or the word is prevent. The word is prevent. Okay, so you have a picture there. Everybody's wearing a mask. Everybody's wearing a mask. Why are they wearing a mask? Why is everybody wearing a mask? Okay, they are protecting themselves from getting sick. They are protecting themselves from getting sick. Do you think masks are the only thing that people need to use to prevent getting sick? No, they also need to wash their hands using water or hand sanitizer. So prevent means to stop from getting sick. So these people in the picture are wearing masks to stop them from getting sick. Yeah? But do you think mask is the only thing that will prevent them from getting sick? No, they need to wash their hands with water and hand sanitizer. Okay, when they go shopping, they need to put on their mask and they need to wear their gloves. Yes. When they come home, they need to change their clothes very quickly. Okay, so these are all the things helping us or preventing us from getting COVID. Okay, next slide. The word is relax. Does he look calm or does he look worried? He looks calm and less worried. He is relaxed. Okay. What are some other ways a person can use to make him or her feel relaxed? A person can relax by meditating or taking a nap. Or you can read a book. You can watch a movie. Yes, to relax. Relax your body and to feel better. Okay, next slide. The word is rough. The word is rough. Oh, this is okay. Okay, the question is, are these players playing in a rough or in a gentle way? They are playing in a rough way. They are playing roughly. Yeah? Does this tackling look rough or gentle? It looks rough. It's very hard. They are hurting each other. Yeah? So rough means very hard and hurting. These guys are hurting each other in the picture. Yeah? Not very gentle. They are basically fighting. Okay. Next word is saliva. Saliva. Okay. Do you remember what is saliva, students? Okay. Saliva. Yeah. Which of these is saliva? Picture B is saliva and picture A is a water droplet. Yeah. Which of these is saliva? Picture B is saliva. Picture A is water dropping. Okay. How do you know? Saliva is the liquid produced naturally in a person's mouth. Yeah. So saliva is liquid in a person's mouth. If we don't have saliva, we cannot speak properly. Yeah. We all need saliva to speak. Yeah. And to keep our mouth area wet and moist. Okay. Picture B is saliva. Okay. Shot. Next word is shot. Okay. Picture A. Is this a shot? Yes, it is. Is it an injection? Yes, it is. Okay. Picture B. Is this an injection? No, it is a sewing needle. Is it a shot? No, it isn't a shot. Okay. So when you go to the doctor and he needs to give you an injection, that is a shot. Okay. Sore throat is the vocab word. Sore throat. Okay. Question picture A. Is there a problem with John's throat? Yes, there is. What is the problem? It is red and swollen. He has a sore throat. Yes, if you look at the picture here of the x-ray, he has a sore throat. Okay. Picture B. Is this a sore throat? No, it is a mouth sore. Okay. In picture B, the baby's mouth is sore. Okay. His throat is not sore, just his mouth. Okay. So throat is at the back of the mouth. Okay. Next slide. Stay fit. Okay. Stay fit. So what does stay fit mean? Okay. Stay fit means to exercise regularly. Which of these do you need to do to stay fit? Okay, you need picture B. It's important to do regular exercises to stay fit. A is not doing any exercise at all. Yeah. So picture B stays fit. Picture A doesn't stay fit. Okay, the word is suffering from. The word is suffering from. Okay, question number 1. Does it look like he has a disease? Yes, it does. What is he suffering from? He is suffering from a viral disease. So suffering from means what is his sickness? Yeah, his sickness is a viral disease. His sickness is COVID-19. His sickness is diabetes. His sickness is asthma. What is he suffering from? Yeah. Or she is suffering from asthma. Okay. The next two vocab words is swelling and swollen. Okay, swelling and swollen. If you look at the picture there, students, 1 hour that's how the leg looks, normal. 3 hours, it gets bigger. 5 hours, the leg gets much bigger. Okay? And this usually happens with um, when you play football or you have an injury to your foot or to your leg or to your hand or to your head or to your arm. Okay, let's look at question number one. Is this foot getting larger than usual? Yes, it is. It is swelling as time goes on. It is swelling. Yeah. Is it easier to walk if your feet are swollen? No, it is difficult to walk. The feet are larger, so walking is more painful. Can you wear shoes if your feet are swollen? No, you cannot. Because the shoes are harder to wear because the feet are bigger than usual when swollen. Yeah? Okay. So a swelling occurs. Yeah? It takes time for a swelling to get bigger and bigger and bigger. Yeah? And then at the end, the feet are swollen. Yeah? Okay. Next word is symptoms. Is symptoms. Okay. So what are symptoms, students? What are symptoms? Okay. Does this little girl look sick or does she look healthy? Okay, she looks sick. Okay, what do you see that shows that she is sick? She is showing symptoms of the flu. Okay, so she is looking tired. Okay, her temperature or her fever is high, or her body temperature is high. She has a fever. She is not playing outside. She is feeling tired. Her body is sore. It is aching. Yeah. Is she playing outside? No, she is sleeping. And because she is sleeping, that is a symptom that something is not right. It's like a sign. Yeah. She doesn't look healthy. She doesn't look good. Okay. Next word is treat. Okay. Treat. Treat means to check for the illness and to do something about it. Okay. Is the doctor helping the patient to get well again? Yes, she is. She is giving her an injection to treat an illness to make sure that she gets better. Okay. Is the person who is punching the man helping him to get well again? No, he is causing him pain. So in picture two, he's causing him pain. In picture one, the doctor is helping the patient to get better by treating the disease or the sickness. Okay, next slide. The word is treatment again. Okay. Okay. Question, picture number one. Can this meal be a treatment for a person with diabetes? No, it can't. Unhealthy food might make him or her sicker. Okay, so this is not a treatment, yeah? Picture number two. Can this be a treatment for a person with diabetes? Yes, it can be. Insulin is a treatment for diabetes. Yeah, so what do we use? A treatment is what do we use for the person to get better? For asthma, the treatment is an inhaler. For diabetes, it is insulin. Yeah, and maybe medication as well. Yeah, okay, that is the treatment. What do we use to make the person better? Okay, the word is turning to. Turning to. Okay, if you look at the picture there are two women. So the older woman is getting out of the car and the younger woman is helping her. Okay, so turning to. So turning to means it's the same as asking for help from somebody else or go to somebody else and asking for help. Okay, the question is, do you think this old lady is struggling with getting out of the car? Yes, she is. She is turning to the young woman for help. So the young woman is helping her. She's turning to her or asking her for help. Okay, when you turn to someone for help, do you ask for help or do you reject help? You ask for help. Yeah, so sometimes our brothers and sisters turn to us yeah, for help. They need help or they need money. Yeah, they turn to you to ask you for help with money. Okay, next slide. Okay, talking about veins now, yeah? Veins, the veins from the heart right through our body. Are veins important? Yes, they are. They help bring back blood to the heart. So the veins bring blood to the heart. Yeah, if we cut veins, would we be affected badly? Yes, we would. Blood wouldn't be able to move from the body to the heart. Okay, so if we don't have veins, the heart doesn't get blood, and that can mean our death. Okay, next slide. The word is warmly. Yeah, the vocab word is warmly. Okay. Okay, question 1. Does she welcome him in a friendly way? Yes, she does. She shakes his hand while greeting him. Should a person feel happy when they are welcomed warmly? Yes, they should. It shows the friendliness of the host. So warmly is welcoming somebody in a nice way. Okay, next slide. Okay. So what are these people doing? They are in the gym, they are running, they are boxing, they're doing weight training, they are exercising. Okay, so another word for exercising is workouts. Okay, are these people doing different workouts? Yes, they are. Are they exercising? Yes, they are. Do you normally do your workouts in the gym or in the bathroom? You do workouts in the gym. Okay, so workouts is exercises that we all do. Okay, we either do it at the gym or maybe we are walking or running outside. Okay, but not in the bathroom. Okay, students, this is the vocab for Unit 7, Presentation 2. I hope it's a bit more clearer for you, and I hope you understand it better. Okay, thank you very much. Take care and good day.